So what draws me to advocacy?
Advocacy is really a part of everything we do. In neurology, we're advocating for our patients every day.
I advocate because it's required. I advocate because our system needs it.
I advocate because it is the superpower.
I got involved in advocacy because I had seen growing up as a child in my family that there were a lot of individuals with neurologic disease who had felt like no one was speaking up for. And even among neurologists who are supposed to be the experts to take care of these individuals, there are some patients deemed just too difficult.
By finding my voice and advocating with the AAN, that brings some clarity of purpose and more empowerment for both my colleagues, myself, and my patients.
It's not just a job for most of us, it's really a big part of our lives. And to propagate that, to further our purpose, this is a brilliant way for us to give back to the community.
I'm looking to make things better for my patients and for other providers, to make it easier for patients to get the care that they need when they need it, in the ways that they need it, and to make things better for today's patients, tomorrow's patients, and for other neurologists and providers in our system.
I serve and I volunteer my time to AAN because it's the gift that keeps giving.
Wow, what a great way to highlight the power of advocacy. When I first started planning our presidential plenary, and honestly that was about 3 months after our last annual meeting, I had the idea to highlight advocacy. And who would have known that the topic would be such the point of discussion right now? Advocacy has always been a vital part of everything the Academy has done. We are seeing right now, more than ever, the need to advocate for you and your patients. The AAN is analyzing and monitoring crucial challenges to neurology, issues with patient access, threats to neuroscience research, the ever-growing time spent on administrative tasks rather than patient care. Challenges that I know that everyone in this room is facing in some form. We want to make sure that you know we have your back. We're actively responding, we're relentlessly pushing forward and making sure you are heard in the US Capitol, in state capitals, and communities everywhere. Our members are actively out there advocating on neurology issues and for their patients. Our advocacy is timeless. It's a voice for ourselves, our field, and our patients. Some of you may already be established advocates. Others of you may be unsure of how to start. Today, we will show you the smallest and most tangible steps you can take to be an advocate in your community, wherever that may be. To start, I'd like to bring to the stage 3 AAN members who are experienced advocates. Please welcome Dr. Hope O'Brien, Dr. Brett Casella, and Dr. Eddie Patton. I'm incredibly proud to call these 3 my colleagues. They've established themselves as experts in matters that affect neurology and brain health and have taken every opportunity to get involved and be the advocacy heroes our field needs. We'll hear from our panel about one of the biggest issues our field is facing and how our advocacy continues to drive progress. Then we'll go into a mini training session where you can pick up some tools that you need to gain confidence to advocate. We want this to be something that helps all of you, whether you're advocating for yourselves, your patients, your practice, your institution, getting involved with the AAN state or federal advocacy efforts, or being a voice for neurology anywhere in the world. So I am going to join the panel. Good morning. Thank you for joining us in discussing advocacy, such an important topic. All right, Dr. O'Brien, I have a question for you. What is one of the biggest issues you or your patients face, and what really inspires you to advocate for change? And maybe give me just a real-world example.
So I want to share a story that highlights the real impact of prior authorizations on patients with migraine. I recently sent an urgent prescription for a patient suffering from a severe migraine episode, knowing that the medication was critical to prevent further escalation. However, I was informed it would take 48 hours to review, despite the urgency. Unfortunately, during that time, the patient's condition worsened, and he ended up in the emergency room and eventually had to be admitted for 3 days. By the time the medication was approved, not only had he missed 3 days of work, but also his 8-year-old's first piano recital. This is just one example of how prior authorization delays not only are inconvenient, they lead to serious emotional and financial consequences for families. For many of these patients, timely access to effective treatment is critical, yet prior authorization delays are often preventing them from getting the care that they need. These delays not only exacerbate the patient's symptoms, but can lead to worsened health outcomes, increased emergency room visits, and higher overall healthcare costs. It's clear that these delays hurt both patients and the healthcare system. I advocate for reforms that streamline the prior authorization process, ensuring that patients can access necessary treatments promptly without unnecessary obstacles.
Thank you, Dr. O'Brien. Prior authorization, jumping through those hoops to get our patients the care they need is certainly a pain point for many of us in this audience. I actually have an audience poll on this topic. We would like to hear your thoughts. So what is the biggest issue associated with prior authorization? Loss of time with patients, questioning your judgment as a clinician, delays in care, or deterrence to appropriate care, or documentation burden? If you'll scan the QR code on the slide and submit your answer. So Dr. Patton, while we're waiting on everyone to answer that question, you've done a lot of work in this space. Can you tell us a few of the progress, advances that you've seen just in the past few years in this topic?
Sure, and Dr. Jackson, as you know, in healthcare, prior authorization and other forms of utilization management, they present particular barriers for both patients and providers alike. As neurologists, it takes away time that we need to be spending with patients, and we're doing more administrative work rather than taking time taking care of patients. The AAN, along with the broader House of Medicine, has been working hard to reduce these burdens. This includes advocating for critical reforms that are recently finalized by the Centers for Medicare and Medicaid Services, putting critical guardrails on how regulated plans can implement prior authorization requirements. The AAN is also working to enshrine critical protections for seniors in law through our advocacy and support of the Improving Seniors Timely Access to Care Act. A third area that I like to highlight is personal to me, which is a legislation that started in Texas that established a gold carding program, which would exempt providers in Texas with a high approval rate where they don't need to go through some of the requirements for prior authorization. While there's no single one of these policies is a magic bullet, each is a building block towards a healthcare system that centers patient need over interference from payers. The AAN is continuing to work to build and expand upon crucial reforms at all levels, federal and state, both with legislators and regulators.
Yeah, thank you, Dr. Patton. So we've made progress, but clearly there's a lot of work to be done. Let's look at the results of our poll. Yeah, and I thought all of the above might be the most appropriate answer, but it looks like delays in care is the winner in the audience. Certainly very challenging. So Dr. Casella, let's boil it down even further. So let's say you have 2 minutes with a policymaker. What's your elevator pitch to tell them the impact of prior authorization?
Thank you, Dr. Jackson. When I'm in clinic, I am completely focused on my patients. So many patients need neurology care, and my clinic hours are limited. Insurance companies require prior authorization before providing necessary tests or treatments, which means I have to interrupt my patient care to call them. They won't provide the necessary testing or treatments that I've ordered until I do. So I have to interrupt my patient care and call the insurance company. I never talk to a neurologist, and often not even to a doctor, to get prior authorization for tests I know they need. The tests or treatments always get approved, making the process a frustrating and insulting waste of time. But these delays do impact patient care, as we noted in the poll. Imagine if you or your loved one had to wait for necessary treatment. How would that make you feel? Why do we allow insurance companies to harass providers and delay necessary care? Every minute I waste talking to insurance companies is one less minute I can spend helping you or your loved one. Prior authorization disrupts and delays our patients' ability to get the care that they need.
Thank you, Dr. Casella. Elevator pitches like this one are certainly an important tool for advocacy. 2-minute summaries that show a busy policymaker why things like this really matter. Next, let's hear from some other members about their advocacy journeys. View the slides.
As a neurologist, a lot of the conditions we see need care rather urgently, and delaying that care can have devastating consequences for the patient, and overall outcomes can be much worse if they don't receive that care early on.
I met a patient in the hospital who was incarcerated and came in with a complicated disease, really complicated disposition, and he went back to his facility, and the ability to follow up with him to make sure that his care was appropriate was very challenging. And that led me to get really interested in telehealth in incarcerated populations.
We had been doing home visits and trying to figure out, how do we make this more sustainable? How is this something that other people could do, knowing that you can't just send a fleet of people to someone's homes, but if we could have a glimpse into their home, right, then telehealth would be an answer.
I was ready to quit after 21 years of training, battling breast cancer, thinking that this is what I want to do, neuro-ophthalmology, serve my patients, but the bureaucracy, all of those wasted time doing prior auths and do all of that. Like, I could not envision myself doing that for the rest of my career.
Advocacy can actually give us the tools to make that difference for our patients and for our colleagues. And it's actually oftentimes the exact right thing that we need to do to restore our own sense of agency, our own power in our experience of being providers, and to help remind us about what is it that we came to neurology to do, and that's to make a difference for our patients.
We need to meet people where they are, understand their basic needs, and then we can help them move forward.
What a testament to the work that you on the panel, so many of you in the audience, and members everywhere are doing. So let's get back to a few more questions. Tell me a little bit about how advocacy ties to well-being. What is the connection between administrative burden and physician burnout?
So Dr. Jackson, every day physicians are navigating complex administrative burdens like prior authorization requests, paperwork, and insurance hurdles. And these detract from the ability to focus on patient care. This growing workload contributes directly to physician burnout, which affects both the well-being of the providers and the quality of care that patients receive. Advocacy is a form of wellness because when we work to streamline these processes, we are not just advocating for better systems, we're also advocating for the health and mental well-being of our healthcare professionals. Reducing administrative burdens allows physicians to return to the heart of medicine, provide compassionate care to our patients, and ultimately creating a healthier, more sustainable healthcare environment for everyone.
Thank you. It can be so empowering to know that you're driving progress and things that really make an impact on you and your patients. When we advocate, we honestly feel no longer at the mercy of forces that are bigger than any single neurologist. Now, Dr. Casella, advocacy ties to so many issues, but can you maybe give me an example of how it ties to health equity, maybe particularly using prior auth as an example?
Thank you. We all want our patients to have the best outcome, so we want them to get all of the testing and treatments they need. When we're caring for diseases of the brain, patients are already vulnerable. Prior authorization delays necessary patient care. It's intended to frustrate both patients and providers. It has a disproportionate effect on people who are disadvantaged. For example, imagine a real case that happened for a patient of mine, that a patient needed an MRI for 2 levels of their spinal cord. And I witnessed an insurance company's prior authorization process force that patient to come in for 2 different studies on 2 different days, rather than doing them both together. Imagine that that patient doesn't have a car or can't miss work because they're just getting by. 2 tests on 2 different days is a tremendous burden. They might not get the full test completed just because of logistics or the financial burden of missing work. If patients don't get the full testing or treatments they need, the insurance companies save cost and add to their enormous profit. But they do so at the expense of the best care for our patients. So advocating for relief from prior authorization is advocating for health equity for our patients.
Yeah. Thank you. This story, as frustrating as it is, perfectly defines the connection between advocacy and health equity. My last question is for you, Dr. Patton. You have been deeply involved in your local community. Can you give us some examples of how we can advocate outside of Washington, D.C.?
Yeah, absolutely, Dr. Jackson. First of all, I want the audience to know that advocacy is vital at all levels. And when I say at all levels, that means at the local level, the state level, and the federal level. In a lot of cases, some healthcare policies and reform, they don't always go to the federal level. They're handled at the state level. And in some cases, like prior authorization, they're handled at both levels. As I mentioned earlier, we are driving really positive progress in reforming prior authorization in Washington, D.C. But Dr. Jackson, it does not stop there. I am deeply involved in advocacy within my home state, well, within our home state of Texas. The Texas legislature, it meets every 2 years, and we're currently in session as we speak. Just last week, I was at our state capitol in Austin, Texas, advocating for issues that are critical for my Texas community, like additional funding for rapid diagnosis and treatment of stroke. Another piece of legislation that I'm really excited about is legislation that's aimed at funding research into the cause, prevention, treatment, and rehabilitation of dementia. Lastly, I'd like to say that every session, we are constantly battling scope of practice issues to make sure that physicians are at the head of the healthcare team. So even if you can't make it out to DC, there's an enormous need to advocate within and for your local community.
Yeah, thank you, Dr. Patton. This work, I hope you know, is important everywhere, at every level. In our field, our research, our patients really deserve advocates, not only at the national level, but at the local level, wherever you may be. So on that note, I'm excited to invite our next guest, who will lead a mini training session. Dr. Sarah Song will provide takeaways to make you a stronger advocate, because that's an essential skill that will benefit every single one of us. So please join me in welcoming Dr. Song.
Hi, so great to see everyone. There's quite a lot of you out there. And thank you for that awesome music when I walked on. I am so happy to be with all of you to share some practical tips and takeaways for advocacy. I know that everyone has had a little bit of a different path, but I can say that without a doubt, being an advocate has made me happier, and it has given my professional life more meaning. I feel like I have made an impact in my own small way. So I want to first make it clear that advocacy can look really different to a lot of different people. It can happen anywhere, and it can go in a bunch of different directions. And you might even be wondering what advocacy really is. Advocacy is simply the act of speaking up and acting on behalf of a cause. And now whatever that cause is really up to you, and it's really whatever you feel passionate about. However, I think I can safely say that as neurologists, we all value certain things in the course of our daily work. We value things like quality, evidence-based care, compassionate care for our patients, access to medications and treatments that our patients need, and for our jobs to not become so prohibitively difficult with paperwork and red tape that they prevent us from doing what we do best, which is to take care of our patients. And it is in this realm, as serving as a neurologist, that I want to talk to you about how we can channel all those emotions at once and just put them towards a concrete ask. And I want to equip you with the skills you need to feel confident to put your ask into action. Of course, not everyone needs to give a testimony in a Senate hearing, and advocacy can be a lot smaller and a lot more personal than that. It really just starts with an idea or a problem and a potential step towards a solution. So, what is something that you want to make better? What is something you notice in your daily practice that could be tweaked to make your patients or your colleagues' lives better? So now that you've identified an issue, what are you going to do about it? Maybe you're going to create pamphlets to educate your patients about a topic you feel passionate about. Maybe you streamline communication in your institution between care teams so that your patients can see other consultants faster. Or maybe you increase the visibility of what you do as a neurologist in your community by testifying at a county hearing or being interviewed by a local news reporter. Maybe you decide to take on a leadership role in your institution or in a local nonprofit chapter or in a state neurosociety. For our international members and attendees, you may have similar or different issues that we have in the US, but I would argue that advocacy is a skill that is universal. It is a muscle you can work on, that you can flex, and once you start thinking of ideas, I venture you're going to be using advocacy skills in ways you never expected. All right, so let's say then that you get the opportunity to get in front of your legislator and their staff. Let's say you have an issue that you're really passionate about and a story to tell. Maybe it's a story about your patient, maybe it's a story about your dad, or maybe it's a story about your daily work as a neurologist. Either way, keeping that passion front and center, you start simple. So you start with an introduction. You explain the context of who you are, what you do, and why you matter to that legislator. Do you live in their district? Do you work in their office's neighborhood? What do you do every day? So we have to remember that legislators do not necessarily know what a neurologist does from day to day. They may not know, for example, that neurologists don't do surgery. We are definitely not neurosurgeons. They may not know that for many of us, we have had to do years and years of fellowship training to be able to practice and treat very specialized patients. And they may not realize that a large proportion of neurologists actually serve as their patient's primary care provider. They may also not know that because many of our patients are so complex, the routine hi and bye of some physician interaction just does not work in our own daily practice. We have to work with families, case managers, therapists of all kinds to get our job done. And that's okay. It is up to us to explain who we are, what we do to our legislators, and to provide them the context from which we are coming from. All right. Then it's all about the story. So never diminish the power of a good story. So you have to realize that legislators and their staff are like super tired, right? So they're all day long, sitting in meeting after meeting, listening to people ask for one thing after another. And every person they meet thinks that their issue is the most important in the world. And throughout all this, they have to remain patient, polite, and kind. So their job is definitely not easy. And so we make it a little better for them by telling them a story that grips, something that is true, something from the heart. So maybe it's a story about an 80-year-old grandmother who suffered from a stroke that took away her ability to communicate, but because of telemedicine, you were able to essentially reverse her deficits so that she was able to talk to her family within minutes of receiving life-changing thrombolytic treatment. Maybe it's a story about how step therapy is cumbersome and ineffective and prevented your young MS patient from getting her necessary effective treatment in a timely fashion. Or maybe it's about how, as a doctor in private practice, You are overburdened with administrative tasks and paperwork, and it limits the amount of time you are able to spend with your patients, and you are experiencing burnout as a result. So remember, we humanize what we do and what we ask for when we tell stories. And it is a lot more conducive to forming a relationship with the legislator, which is ultimately what we really want to do. In the end, after you leave, you want them to remember you. You want to be able to reach out to their office and know who you are. And they are much more likely to call you if they have any questions related to something about neurology or medicine. Okay. Then after the context, after the story, you give them the ask. All right, so there's a couple of rules to think about what that ask might be, and you should do this ahead of time. The ask has to be simple, and it has to be easily understandable. So, as an example, take prior authorization. So most people understand that when physicians prescribe medicines or procedures, it's because they're necessary. And we want to make sure that there is transparency between what is needed by patients and expediency between getting studies and medications approved quickly. So legislation to streamline prior authorization and standardize the process by which medications are approved is a super easy ask from a physician to a legislator, because it makes it easier for our patients and their constituents to get the services and the treatments that they need quickly. Secondly, you want to make sure that your ask is timely, meaning that it's a tangible issue that is happening now with a goal that is attainable in the near future. And that also means that the ask is actionable, meaning that there's something potentially on the table or nearly on the table that you can ask the legislator to take action on. For example, it might be a bill on step therapy that's been introduced, and you can ask the legislator to co-sponsor. That is an actionable and timely ask. And having something to point to that the legislator can say yes to is golden. Finally, the ask has to be relatable. More than anything, we want to enact change that's going to affect most neurologists for the better. Yes, we may have our very specific, remote, and unique wants and needs, but on this front, it really is better for the ask to be something relatable so that all neurologists or all doctors, or most of them, can relate to what you're asking for. So this is actually something that we work on at Neurology on the Hill, which is an annual incredible event that takes place in DC that you may have heard of. But I want to encourage all of you to think about what matters to you and what your ask could be so you can speak about that for yourself. All right. So after all that, you open it up for questions, and then you get to talk one-on-one with the legislator and their staff, or more likely than not, that's all the time they have. But you will have done it, and you will have given your context, your story, and your ask. And most of all, you'll have had that conversation, and you'll have made that connection. And if you make that connection, you can form a relationship. So, after all that work, make sure to solidify the impression you've made by following up, thank them for meeting with you, share any additional information that they asked for, and offer to be a resource going forward. And hopefully in the future, you can be that trusted resource for that office on all things neurological or even medical. Luckily for all of us, the AAN has a very experienced and passionate advocacy team that is ready to work with you on all your big and small ideas. All you have to do is reach out to them. Besides Neurology on the Hill, we have the Palatucci Advocacy Leadership Forum, which puts neurologists through a rigorous training program of communication skills, goal setting, and relationship building. It has been a real inspiration to see PALF graduates coming up with their ideas and seeing them to fruition. And if you have ever been interested in this program, I hope you'll consider it because it is awesome. I think it is life-changing. And I'm very excited to say there's an international pilot program of PALF that is starting at this very conference called the Global Advocacy Leadership Program. This brings together neurologists across the globe with seasoned AAN advocacy faculty and staff to develop and work on individual projects. And I cannot wait to see where this collaboration with our international members will take us. I also want to remind you that advocacy can be as simple as sharing education with your patients and urging them to read accurate health information. I know I'm biased, but Brain and Life is a free magazine published by the AAN with neurologists, excellent neurologists, helming the editorial board, and it is a great source of accurate health information. We write and review every story carefully, and we put patients first. There's an awesome podcast, we have a social media team, we have a website, and we have some new initiatives in tow for the next couple of years, so please stay tuned. And please reach out, go to the Publications Hub, we have lots of copies. We'd be happy to send copies to your office. Again, they are free for all of your patients and for you. All right, so I hope I've made it clear that everyone here can be an advocate. You just need 4 things: an idea, a story, an ask, and a follow-up. How you get there is up to you. And with that, I will hand this back to Dr. Jackson. Thank you.
This is such a great way to share this information. Thank you, Dr. Song. So, how do we tie all of this together? And how do you take the first step? One way is the AAN's Action Alert. These are messages that will take you less than 30 seconds to send to your local representatives, providing information and a call to action on something that impacts neurology. Action alerts are one of the simplest ways for AAN members to get started in advocacy. They will help you stay informed and educate your policymakers. In fact, to prove it, we have an action alert ready for members here right now. So this one urges your legislatures, both at the state and the federal level, to take action to reduce the ever-increasing burdens of prior authorization faced by you and your patients. And this isn't the only action alert that you can take to protect neurology. There are other action alerts in the Action Center right now, including one protecting neuroscience research funding. So this is in your inbox, and it's also a QR code you can take a picture of right now. And it's literally just a matter of going into your inbox, seeing the action alert. You can click the button, fill in the information. Your legislator information is already there. Click the button again, and it's off. So easy. You can also access all of the current action alerts in our AAN Advocacy Action Center. I also want to let you know, Happy Advocacy Day here at the annual meeting. I hope you'll join us today at the Practice and Policy Hub for a full day of advocacy workshops, panels, and ways to connect. Then there are 3 things, just 3, I want you to do by the end of the day. First, I want you to complete that action alert. I promise, again, less than 30 seconds. It's a great way, great tool. And second, I want you to visit the BrainPack booth in the sales pavilion. There is so much to learn about what it does for you and your patients. There will also be BrainPack supporters outside the hall to answer any questions you may have after the end of this plenary. The third thing is to start reading the Capitol Hill report and encourage your colleagues to do the same. This is our main communication vehicle to keep you updated on everything we're doing right now to support you. Please know this important work is something the AAN does 365 days a year, both from our public office in Washington, D.C., and through the efforts of members everywhere. We will not rest until you and your patients have everything that you need. Every voice matters in neurology. Your experiences, your stories, your skills, they all matter. Everyone here wants a future for brain health for all. And when we work together, we can make that happen. So please join me in giving a second round of applause to Dr. Song, Dr. O'Brien, Dr. Casella, and Dr. Patton. Thank you so much.
Thank you.